Kirloch. I'd like to welcome the Minister to the Chamber today, and I just want to say I'm really happy to speak in favour of this motion, and I want to commend my colleague Senator Joan Freeman on bringing it forward. And I'd also like to join in my colleagues in stressing that 24-hour access to mental health services is absolutely essential, and that the funding must be made available to address this need. At the moment, thousands of children are struggling to cope with mental health problems due to failure to properly resource emergency and acute services. Since 2014, demand for mental health services has gone up almost 30%. However, as of July 2017, almost 2,500 children and young people are still on waiting lists, unable to get the help they need. Many have been waiting for over a year. This is just one example of the urgent need to invest in better public services. It must be a priority for the Government, Minister. I know from my own experience of working in the field of addiction that problems do not arise solely in working hours. The need for 24-hour access to mental health services is essential, and it is often out of hours or weekends when people need urgent help. People will talk about the cost, but the cost of providing 24-hour access to proper mental health services can be met by the savings on future treatment. The World Health Organization suggests that in the field of mental health, early intervention is fundamental in preventing progress towards a full-blown disease and controlling symptoms and improving outcomes. We need to focus on prevention, not cure, and early intervention through proper services is the key to this. We have made big strides in our ability to speak openly about mental health, but we need investment in services to match it. Particularly with young people, investing in mental health at early ages represents the most cost-effective action to prevent the continuous increase of mental health problems in all age groups. Our understanding of effective treatment needs to be moved beyond the concept of recovery as getting rid of a disorder to one that can instil positive values and behaviours that enable young people to flourish, contribute to society and be happy and healthy. People's young years are often the peak period of incidence for mental health problems, yet it is where supports and services are most lacking. A major Irish study found that at least 1 in 4 Irish teenagers have experienced serious mental, emotional, behavioural or mental health problems, and almost 1 in 10 have self-harmed. Ireland currently has the 5th highest rate of youth suicide between age 14 and 24 in the EU, with 90% of suicide linked to mental health difficulties. Proper services are key to bringing these figures down. I mean, it really is shocking, Minister. I mean, we are really in a crisis around mental health when we look at these figures. I suppose Sherry McDade, the Director of Mental Health Reform, has called on the Government to allocate additional funding to meet the core funding gap in the HSE's mental health budget. This is estimated that £65 million is needed just to meet the current level of demand for care. This is not extra money. It's core funding to ensure that there are adequate beds for people with highly complex, severe mental health difficulties who need long-term residential care. It is the funding that provides residential services for people with eating disorders. It is the funding for services that have a shortage of inpatient beds for people in acute mental distress. It is the resource needed to respond to the 26% increase in referrals to child and adolescent mental health services between 2012 and 2016. One key area I really want to stress, particularly from my own work in this area, is the issue of dual diagnosis. When a person suffers from both a substance abuse problem and a mental health issue such as depression or an anxiety disorder, I believe that if we don't treat both together, you can't beat it together, and you can't beat it either. And I know my own experience of working as a therapist, Minister. I've worked in the Rutland Treatment Centre with those who have been in addiction, and I haven't met anybody that hasn't had an issue around depression or anxiety or stress or some form of trauma in their life with regard to mental health. So it really, really does go hand in hand, and it could be the same for mental health. People who present with mental health issues, will turn to alcohol or drugs to just numb out. So they're very, very closely linked, and it's really important that we look at this issue together, the dual diagnosis. Because most mental health services and addiction treatment centres in Ireland are currently not organised to treat such people holistically. For example, if you have difficulties abstaining from alcohol due to anxiety, you cannot enter rehabilitation services. Most residential drug services insist you must be dry before entry. So this is where it gets confusing, Minister. Yet you cannot get your anxiety problem treated until your addiction to alcohol has been addressed. So that's where people are falling through the loop. Again, we need a joined-up approach and a real system for dual diagnosis. If we integrated addiction and mental health services, it would help reduce the suffering of people and their families, and the resultant savings could help fund the badly needed 24-hour service that has been spoken about so passionately today. Father Peter McVerry, who has been providing accommodation to homeless people in Dublin since 1979, is clear on this. He says the holistic needs of the individual are not being addressed. There are too many borders between homelessness, drugs, mental health. You need to be in one category or the other to be dealt with. When you are in multiple categories, the system breaks down, and it's when you are in multiple categories that you are in most need of assistance. I don't see any joined-up thinking, or at least the practical delivery of services in a joined-up manner. We needed to develop multidisciplinary teams that are capable of dealing effectively with the totality of the problems that people have. I just also want to talk a little bit on the I set up an organisation myself called the Rise Foundation, which deals with family members who have somebody they love with an alcohol, drug or gambling problem. And a lot of the family members, it's actually a mental health services, because we deal with the family members who are highly stressed, who are really anxious. A lot of them, particularly if they're adult children of alcoholics or drug addicts, end up with severe depression, suicidal tendencies and sometimes even have physical ailments. You know, and unfortunately, it just gets no government support whatsoever, and yet we have about 3,000 people have come to our doors. So it's really, really worrying. So if that even doesn't get any support, then it's not really looking good. So I want to commend, and I really do want to commend the Senator today on her fantastic work. She has done unbelievable. Pieta House, as we all know, it's beyond the beyond, and I know lots of people who have attended, family members who have attended Pieta House who are in crisis. They have been phenomenally brilliant, and I just really do want to pay a huge tribute today to Senator Joan Freeman. But I want to commend this motion again and offer my full support, and my key message today is that we must do better on dual diagnosis and also look at the issue around family members who have been reared in homes where there has been alcohol or drug misuse. People are slipping through the cracks, and it's not acceptable. If we show leadership on this issue, the savings we can make in properly addressing mental health and substance misuse problems can more than compensate for the additional funding needed for these services. I really do hope that you can hear today what we're saying, and I know you're a good man, and I know that your heart is really, I know you're very passionate about this issue, but I do hope it's reflected in next week's budget.
Thank you, Senator.